Today we're diving into fibromyalgia. It's a condition that millions of people live with every single day, but it often feels completely invisible to the outside world. And we're going to tackle the one question that is so frustrating for so many. Why does your body ache all over, but every single test your doctor runs comes back, well, normal? Does this sound familiar to you? You're in real pain, it's widespread, you're exhausted, and you've got a list of other symptoms. So you go to the doctor, they run all the tests, blood work, maybe an MRI, and the results all come back clean. It's a moment that can feel so incredibly confusing, even invalidating. But what if I told you those normal results are actually a really important clue? Okay, let's get into it. So first things first, why do all those standard tests seem to miss the mark? Well, it's because they're basically looking for the wrong kind of problem. Let's try an analogy. Think of your body like a computer. Most medical tests, scans, blood work, they're designed to find hardware problems. Physical things like inflammation, actual tissue damage, or signs of an infection. But fibromyalgia, it's not a hardware problem. It's more like a software problem. The issue isn't in your muscles or joints themselves, but in how your central nervous system, your brain and nerves, is processing all the signals it's getting. And that's exactly why those normal results are so crucial. Your doctor is basically playing detective here, and every normal test lets them cross another suspect off the list. It helps them rule out conditions like rheumatoid arthritis or lupus, which do cause inflammation that would absolutely show up on those tests. So this whole process of elimination is a huge step toward getting the right diagnosis. So if it's not damage to the tissues, then what is it? The best way to explain what's happening is with a concept scientists call the brain's volume knob. Okay, the technical term for this is central sensitization. It sounds complicated, but all it means is that the entire nervous system, so the brain and the spinal cord, has become extra sensitive. It's stuck in a state of high alert. The simplest way to think of it is just like that volume knob. In someone with fibromyalgia, the volume control for pain gets cranked way, way up, and then it gets stuck there. So all the sensory information coming in gets amplified. And hey, this isn't just a theory. We can actually see it on brain scans. Functional imaging studies have shown that for someone with fibromyalgia, it takes a stimulus that's 73% weaker for them to feel the same amount of pain as someone without it. The point is, the pain is not just in your head. Your brain is genuinely, measurably processing these pain signals way more intensely. So what does this actually feel like in day-to-day life? Well, it leads to two really common experiences. The first is hyperalgesia. That's when a little bump feels like a massive injury. And the second is allodynia, which can be even weirder. That's when you feel pain from something that shouldn't hurt at all, like the fabric of your clothes or even just a gentle touch. Okay, so if we can't just use a blood test or a scan to find it, how do doctors diagnose this software problem? Well, the way we diagnose it has had to evolve right along with our understanding of what's really going on. Yeah, the process has changed a ton over the years. Way back in the 70s, it was called fibrositis, but they changed the name because they realized there was no itis, which means inflammation. Then, in 1990, they came up with the tender point exam, but by 2010, our understanding had grown so much that we needed a better, more complete way to diagnose it. This is that old model. A doctor would physically press on 18 specific points on the body to see how many were painful. The problem? Well, a person's pain can change from day to day, and this model totally ignored all the other huge symptoms, like the crippling fatigue or the cognitive issues. It just wasn't capturing the full story. So today's approach is much more comprehensive. Instead of just those tender points, doctors use two key measures. First, the widespread pain index, which basically maps out how many areas of the body are in pain. And second, the symptom severity scale, which, and this is so important, finally gives proper attention to the fatigue, the bad sleep, and those cognitive problems people call fibrofog. And looking at the whole picture is absolutely key, because fibromyalgia isn't just one thing. It's a complex syndrome. It's really a whole cluster of symptoms that go way beyond pain and can affect everything from your mood and your ability to think clearly to your physical energy. Now, I know this can all sound pretty overwhelming, but really understanding what's going on is the absolute first step toward managing it. So the big question is, what can you actually do about it? First, and this is important, we have to set the right expectation. Right now, there is no single cure or magic bullet for fibromyalgia. The goal of treatment isn't some one-time fix. It's all about developing a long-term, personalized strategy to help you turn that volume knob back down and get your quality of life back. The approach that works best is what we call a multidisciplinary one. Step one is education, learning about it. just like we're doing right now. Step 2 is building a foundation of non-drug therapies that actually help retrain your nervous system. And step 3, medication can be a really helpful tool to support all of those other efforts. So let's peek inside that management toolkit. The core strategies are things like graded exercise, and that just means starting super slow and gentle to build up your tolerance without causing a pain flare. It also includes things like cognitive behavioral therapy or CBT, which helps you change how your brain responds to those pain signals. Pacing yourself and focusing on sleep are huge too. And yes, there are FDA-approved medications that can help by targeting the nervous system directly. One important note, opioids are usually not recommended because they don't treat the root software problem and can even make things worse in the long run. So what's the one thing you should take away from all this? It's this. Your pain is real. The science backs that up, and those normal test results are not a dead end. They are the starting line. The best thing you can do is go to your doctor with this information and ask to be a partner in building your own personalized management plan. So I'll leave you with this final thought. If you stop trying to fix the hardware and start focusing on retraining the software, what parts of your life could you get back?